So we're doing a number of different things to try and both support people at the moment who have who have coronavirus or who may be suffering through the public health restrictions, as well as trying to find out things that will help us and the world manage this and other similar epidemics in the future. So in terms of services, well, we've changed our clinics. Like many other places, it's predominantly telehealth at the moment, and that suits a lot of people, and we can do a lot of good work with that. That's happening in a lot of places. We've added to that a kind of a drive-through service. We need blood tests on people in order to understand where they are with their diabetes. People who are monitoring their blood sugar on their meters, when they come to the clinic, we normally connect them to our computers, download all of their readings, and that helps us as doctors and healthcare professionals to analyse what's happening and to make the right recommendations. We're currently running a drive-through service where people can just drop those off for 5 minutes. So they turn up outside the clinic, we do a blood test on a finger prick, they give us their meter, and we return it to them 5 or 10 minutes later. And that provides us with the information that we can then do a telehealth consult with someone, but have all the information as if the person was actually there in the clinic. So that's one thing we're doing. We're running an information line for anybody who feels, and that's not just for our patients, but anybody who feels anxious and would like to know more about diabetes and coronavirus, as well as for heart disease as well. But we're also doing a number of research studies, trying to understand how this is affecting people. One example of that is one that I'm involved in, the PREDICT study, which is looking at, in a large sample of people with type 2 diabetes, it's generally trying to understand complications of diabetes. And because we have many hundreds of people who took part before coronavirus, we're currently contacting everybody who did that and asking them similar questions about their lifestyle and about their use of health services to try and see what the impact of the lockdown is and the restrictions, what impact that is making on their lives. Because we know that if people with chronic diseases such as diabetes are not getting the right sort of care, are not having tests, are not seeing their doctors, it's going to impact them down the track.